Hi. So this is Dr. Jen Dickinson from midmopelvichealth, and I took a little hiatus from the Lunch and Learn and decided to reinstate it. So at the beginning of the year, I think every Monday I was doing like a little 5 to 10 minute video on different pelvic floor topics, and took about a 3 month break from it, and now we're getting back to it. I do think I'm going to probably switch to like every other Monday just to help kind of make it a little more sustainable. But if you have any specific topics that you want me to answer, please shoot me a message. I'm happy to take suggestions and questions and all the things. I want to give you guys as much of the information that you want as possible. So this is all for you guys. The topic for today's Lunch and Learn is on the 3 types of pelvic floor treatment. I think there's a super common misconception that pelvic floor physical therapy, pelvic floor occupational therapy is just kegels or just biofeedback. I know there are a handful of gynecology offices that say that they offer pelvic floor therapy, and they can use that term because it's not a physical or occupational therapist doing it. It's typically a different staff person, a nurse, or somebody with some credentialing, but just not a pelvic floor specialist. And a lot of times you'll just get hooked up to biofeedback or internal stim, and they leave the room for 20 minutes, you come back and repeat the cycle. But that's not what true pelvic floor physical or occupational therapy is. And so I'm trying to dispel some of those myths. So I utilize 3 various types of treatment during pelvic floor therapy. And in redoing a lot of my intake information and handouts and stuff, really tried to hone in on what exactly I want that to look like. And I came up with a Venn diagram that has 3 parts to it, because frequently, an exercise or a stretch or an activity can kind of fit into more than one of those categories. So did this little Venn diagram. Now granted, it's going to be backwards for you guys, so I'm not going to hold it up, but just visualize sort of a 3-part Venn diagram and walk with me here. So the very first type of treatment is considered direct. I think that's what most people think of when they think pelvic floor physical therapy. That is where we are working directly, get it, on the pelvic floor. So whether that is internal pelvic floor muscle work, stretching, trigger point release, anything like that, or even more homework-based direct techniques such as using wands or dilators or anything like that. I don't know that I've shown wands or dilators on here, so if that's something you're interested in and I can kind of walk through that, please put a comment down below or shoot me a message, and I'd be happy to do one on some of those devices. But that's more of the direct technique, and so kegels would fall into that category. But honestly, if you are going to pelvic floor therapy and they are only doing one of these 3 things, you're really getting a disservice, and it's not addressing the whole person. You may make some improvements, but it's probably not going to be sustained, and it's certainly not going to help you get kind of above and beyond where you think you can get in terms of like leakage symptoms or pain symptoms and so on and so forth. The magic really starts lying in being able to mesh all 3 of these together. So the next one is what's called indirect treatment. So that's where we work on structures that attach to the pelvis and the pelvic floor or have really close connections, such as the fascial system within your body. That's kind of like the communication highway from muscle to muscle and so on and so forth. That's where we would work on your hips, your low back, scar tissue on your belly from C-sections or any other procedures. That is also what would constitute working on your neck or your ankle, or just there's lots of things that have influence on your pelvic floor that, again, if you're ignoring those parts of the body and you're just working directly on the pelvic floor, you may get better for a couple of days and then symptoms come back, or you may get better just with very minimal activity, like, okay, now I can sneeze without peeing my pants, but still if I do a jumping jack, it's game over. That's where you are missing out on some of those other techniques that are playing a role. The third, and probably, in my personal opinion, the most important one that frequently gets left out, is your nervous system. So it may sound kind of woo-woo, or like, I'm coming for pelvic floor stuff. Why are you telling me to breathe? Or, that sort of thing. So the analogy that tends to make the most sense to my patients is what I'm going to use here. So your body is designed to adjust, right? It's really good at homeostasis. And your nervous system is in charge of a lot of that. You have hormones and some other things, but your nervous system is really in charge of a lot of it in terms of the muscle homeostasis. And when you think about your nervous system, you can kind of think about a dimmer switch, right? Most people have heard of the fight or flight stage or the rest and digest stage or system. And so they kind of exist on this continuum. So think about fight or flight is up here, all the muscles are on, we're getting ready to run away from that threat, all the way down to rest and digest, right? Which is exactly what it sounds like. Muscles are nice and relaxed, your digestive system can kind of do its thing. And when your nervous system is up here and it needs to live down here, we're going to have a really hard time getting your pelvic floor muscles to relax if we're not addressing the nervous system. So think about your nervous system as being like the thermostat in your house. If your thermostat is set to 85 and you're hot, there are a couple things you can do. You can do things locally, like turn on a fan, take less clothes off, drink some cool water. Those are things that you could do to kind of give you temporary relief. But really, unless you go over to the thermostat and change what that set point is at, you're not really going to have lasting change. So that's where, in order to truly affect the tension that your pelvic floor and other parts of your body that influence the pelvic floor are holding on to, you really have to address that nervous system. Kind of pointless to just fan yourself for 6 hours unless you can go over to the thermostat and turn it down. So hopefully that kind of helps discuss a little bit of what we do beyond kegels, or different things that a lot of people think of when they think pelvic floor. It was a very oversimplified sort of explanation of it, and again, it's very individual. It depends on the person's personality, it depends on the person's body, depends on their experience with the medical community before. So I didn't even go into how trauma affects, all three of those things. But truly, for a pelvic floor dysfunction of any kind, doesn't matter if I just leak a little bit or I've had chronic pain for 20 years. If you are going to a place and they are not addressing all three of them, you're probably not getting the best care. You may get better, and I hope that you do, but please make sure that your provider is giving you a very whole body, well-rounded, holistic approach to providing change, but then also really helping you live the best life that you want. So my eval is spent figuring out, okay, here's where your body's at. This is where we want to be. How do we create that bridge between the two to really give you the best life possible? So again, if you have any suggestions or questions on different topics, I would love to address those specifically, kind of before I go into some more of the basic stuff that I covered in previous videos, but we'll give it a new spin because I never say the same thing twice. All right, that is it. Have a fantastic week, and I'll see you in a couple weeks.